after losing someone.
Yeah, of course, last week after we learned about the death of 2 Bristol police officers and another officer who was injured, we talked about the trauma events like this can really cause, but grief is different.
Yeah, Dr. Saunders is here now to tell us about how this is all different. Good morning to you, Dr. Saunders. How are you doing today?
Good morning. I'm doing well. Thank you for asking.
All right, so Dr. Saunders, what's the difference between trauma and grief?
So that's a really important distinction to make. And trauma is usually the reaction, and there's a whole host of reactions that can fall under a trauma reaction. But trauma is that series of reactions based on usually a serious or catastrophic event. There is something called complex trauma, which is the buildup of negative life events that cause a trauma response, whereas grief is different. Grief is that in the intensity of emotional pain, sadness, usually based on a loss. Now, they're often couched together because you can have a traumatic experience and then have grief. But what often happens is that grief gets stirred up based on other losses.
Well, Doctor, you know, what's interesting about this story is we've been talking to so many people in the community who didn't even know these officers, and yet they still are feeling feelings of personal grief. Mm-hmm. Is that normal? How does that happen with someone that they don't even know?
So it's fairly common that any grief, it could be unresolved grief, it could be what we call anticipatory grief, which is where you start to grieve something that hasn't even happened yet, the loss of a loved one who might be very ill. Any grief reactions that sort of reside in your emotional response system get stirred up, especially after such a strong and really negative loss such as the police officers. So it stirs up grief from other situations or past losses. And so that's why it's so important to actually address grief when it comes up in your life.
Well, and that's a good point to jump off of at this point, because how do we all address grief? Everybody handles things differently. People like to talk about things. Some people don't like to talk about things. They handle it more internally versus externally. What's the best way for us to kind of go about these kinds of feelings?
So I do think that addressing the grief directly, meaning, you know, letting yourself be really sad. And I think sometimes people are afraid to allow themselves to be sad because they worry that it'll just be a well of sadness and they'll never be able to get out of it. But that's really not the case. The more you can kind of allow yourself to feel the pain, to think about the loss, to experience that loss, it actually helps you move through it. And that's what's really critical in situations like this. It's when people sort of tamp down the loss and pretend that it's not there, pretend that it's, you know, doesn't really affect them. That's very often when we find that it comes back to affect them over and over and over again.
Well, and that's an interesting point as well, because you made the differentiation between trauma and grief, but can they be related, and that might be why people try to suppress those feelings?
Yeah, and honestly, they're really painful. Right. Dealing with loss and grief is really painful. To think about the loss of a loved one, it's painful. People just want to sort of put it aside. But what we know is that if you don't find safe ways to step into the grief and to talk about it, or I don't care if you journal it, if you draw pictures, whatever you need to do to address the grief, it's really important. I've been listening to a podcast by Anderson Cooper, who's really talking about grief and loss. And some of these things are really powerful. So whatever you need to do to address the grief and loss, that's what you should do.
Well, Dr. Laura Saunders, thank you so much for checking in with us. Your advice is really helpful, especially during what's been a really difficult time for so many people here in Connecticut. So Thank you again for joining us.
Thank you for having me.
Yeah, thanks, Dr. Saunders. I'll have to check out that podcast, too.